Hey everybody, happy Friday. I'm
Good
Crystal
morning.
with Yes, right. I'm Crystal with She Looks Like Me
I'm Crystalline.
and today we are coming with another I guess an episode, we want to call it that, with In the Know. We had some good feedback about how informative our last session was. And so we just really want to come and talk to you again, just have a few little conversations about what's in the news regarding HIV. So I'm going to go ahead and kick it off and get straight to it because I know that y'all have things to do on this Good Friday. It's beautiful weather. Thankful for this beautiful day. And so let's go ahead and dive into it. I know it was something that we didn't really discuss last time because we kind of ran out of time. We're trying to keep it to 30 minutes. But when we were talking about HIV and how we are truly going to end the HIV epidemic by 2030, I wanted it to be done by 2023.
Do
Um,
you?
but they really talked about the workforce and pretty much educating the workforce. So if we have people that are in the world that are physicians or, people, nurses or nurse practitioners or PAs, they really stressed a lot about how that is supposed to look in the future if we really want to end it. And they really talked about expanding the roles of the personnel that you already have. For instance, pharmacists, they were a key part to it as well. Many people don't know that pharmacists probably they know medication better than
Hmm.
the physicians,
Yes.
almost. And so they were really talking about expanding and making maximize what their degree has prepared them to do. So, like offering education about medication, even given certain medications in that facility. They were also talking about how the disciplinary teams work together and maybe having like a one-stop shop, expanding the role of the hospital where patients may come in and get HIV expand role nurse practitioner. I didn't have my form here, but it said that the outcome for patients were much higher when you utilize nurse practitioners to their fullest, to the fullest extent of what they're doing. And so, if we're really being about it, I don't know why, Alabama's probably always glad to make some changes, but how do you feel about that?
Yeah.
I disagree with it, I think.
As I was listening to some of that information about expanding the roles of the nurse practitioners and the PAs and the outcomes that patients had, being educated and receiving the medications because they were a little more apt to prescribe it and that they were having better outcomes. That was very encouraging. Being a nurse and seeing so many more nurses achieve nurse practitioner level of education and more of us going out into the career field, that does give me some hope as it relates to us ending the HIV epidemic by 2030 as we increase the volume of nurse practitioners, PAs in the field. If they're getting this education and going out, then they could disseminate that to these patients and we could definitely improve the outcomes so for the community. So yeah, that was
Yeah.
very interesting, and I was glad to um, get that information. The other piece that I kind of thought about as it related to education, um, I had the opportunity to speak to some students that are entering into healthcare, but they were entering into gateway careers. The PA, the MAs, medical assistants, pharmacy techs,
Lobotomists.
those people. And so, trying to get them some education about HIV, the stigma around it, so that they can go out into the world, even though they're not going to be prescribing and particularly educating on the disease, but giving them some information about stigma and how it would relate to their practice and how they will deliver care for these patients. And there will be opportunities for them to give some education, but there's it was good to give them some education as to how they can manage treating those people, caring for them
Mhm.
with love, and not having those stigmas and barriers to, feeling like they can't care for them. So that was
Right.
good too. So I'm just very encouraged about the education of the community as it relates to HIV and what we're doing here, being able to educate on both ends. Like I said, the people that are be prescribing,
Mhm.
treating on the higher end of this spectrum with the physicians and nurse practitioners, but also the gateway careers that are coming in, the PCTs, nursing assistants, and pharmacy techs. So yeah. That's
Yeah. And speaking of about the whole community, that just really shows you the impact that can be made when everybody takes part in it, and it's
right.
going to be required. And I was on a training this week that was given the physicians kind of like a challenge for us to really end the epidemic, and the challenge seems like it was um, so small, but when you think about it, the huge impact that it could
Paramount.
actually make. And so the challenge was for each physician to prescribe two patients prep, two new patients prep. And guess how long? It was for over 2 years. So that just shows you how often a doctor outside of someone that deals with HIV or patients, that's surrounding that, that just shows you how much the physicians may not be talking about it, or
Mhm,
they may not just be aware, or they're
mhm,
just not their specialty, and so they feel like the responsibility may lie on someone else.
mhm.
Probably more like your GYN, but
Yeah.
our men, they don't go see a GYN.
Oh,
You know what I mean? And so
absolutely.
so that just shows you that we really got to get out there and talk about it. And we are very much so available to come and talk to any agency,
And
or at any point, any environment, that we're usually available to kind of get the information and get the word out. And we do have some things in the works that will probably come over the next couple of weeks as we start to receive our tests. So be on the lookout for that. So let's go into one of the articles that I did find. This is one of the doctors that his kind of discussions about a 2022 virtual conference on retroviruses and opportunistic infections. So this was kind of his breakdown on what took place, and some of the research that has come forward over the past couple of years. And so this one is related to HIV cure research, and it talked about a person whose HIV was in remission as a result of a stem cell transplant with an HIV resistant mutation. And so I do have this information right here. It was a woman who received a cord blood stem cell transplant to treat acute myeloid leukemia and has no detectable levels of HIV for 14 months, despite cessation of her antiviral therapy. So that means she has
mhm.
not been on her HIV medication, and for 14 months they have not been able to detect any levels of HIV in her blood since. And so this is the third case. So people that say you can't be cured, God is real.
Yeah.
And she essentially has been cured from, or she's in remission. I'll
Remission.
say that. Yes. And so the research was conducted by the International Maternal Pediatric Adolescents AIDS Clinical Trial Network. It's called Impact. And out in California. And so this study began in 2015 and was based on an observational study. I want to let it be known that because she was a patient that had other things going on, it wasn't just like a regular patient that was HIV positive.
Yeah.
This person had leukemia, so there were different things that were taking
Multiple
place.
comorbidities. Yes.
She
Yeah.
Yes, yes. And for people that may not know what that means, that means she has different diagnoses coming on going on all at the same time. So, just in case we have
Yes.
somebody watching that is not familiar with that. So she was the first one that she of mixed race. They wanted to point that out. And she had been living with the HIV infection for over 4 years. And she achieved leukemia, the remission after chemotherapy as well. So prior to receiving her stem cell transplant, her HIV was well controlled but detectable. So
Mm.
that lets you know there, how far she came from that. So
Yeah.
her HIV readmission resulting from stem cell transplant had been previously observed in 2 cases. The first was a Berlin patient, a Caucasian male, and
Mhm.
he experienced his remission for 12 years and was deemed cured of HIV. So I guess I
Wow.
can use the word cured. I mean,
Yeah.
12 years, come on.
Wow. That's
And then he
huge.
died of I know. But unfortunately he did die of leukemia in September of 2020. And then there was a London patient, a Latino male. He's been in HIV remission for more than 30 months. And the third case is this young lady right here.
Mhm.
And so he kind of talked about this one. And I wanted to read something else. About 37 months, I'm going to stop taking it. So she has not been taking her therapy, like I said, and it has not been detectable for. Anyway, the importance about it is just saying that what this means for the future.
Mhm.
I know they were treating patients that had other things going on. At least all 2 of them were linked to leukemia. But hey, if they can do this for this patient, I mean, I am hopeful that there's possible that it can be a cure for all patients.
Yeah.
And I'm excited to hear what can come from that.
Yeah.
That's amazing.
Yeah, definitely excited to hear about anything, especially around stem cell research. My only fear, especially being here in Alabama, in the Bible Belt,
Oh yeah.
all of the um, backlash,
Ethical.
all of the ethical
Yes.
questions, and being that we are a faith-based organization, a lot of faith-based organizations are, staunchly against stem cell research
Yes.
because of the relationship of it to gathering some of those stem cells from aborted babies. So I pull that piece out of it, my mindset, but just the sheer thought of the research itself and the
Yes.
possibilities of being able to cure someone of a disease using that type of research from stem cells, not because we created the stem cells, but because God
Right.
created those stem
That's
cells.
right.
And they
It's
have
almost like
healing
they
property and everything
created.
that we need.
Right.
Everything that we need is within us. And so, yeah, that is very encouraging, and it's exciting to even hear that we're graced with that brilliance to unlock
Mhm.
that piece of humanity and divinity. Yeah.
Yeah. Yeah. Yeah. So this one still on this conference, they were talking about very, very early treatment in infants and the promise of HIV remission. And so this one was talking about basically exploring the effects of early intensive therapy, like giving them medication early and achieving HIV remission in infants. And so they kind of talked about two small cohorts of children who acquired HIV and began receiving their therapy within 48 hours of birth. And so they kind of saw that infants had achieved suppression defined as HIV RNA less than 200 copies, and that's how they kind of monitor, how much if you're detectable, if they
Detectable
can
or
detect it in
undetectable.
the blood.
Mhm.
And so at 6 months of age, so they also had, I'm flipping over, they also said that most of the children had no HIV DNA at 2 years of age. And so having a smaller reservoir may take make it possible for these children to stop taking therapy
Yeah.
and still maintain a viral suppression. So I am so fascinated by the reproductive health and HIV and prevention and declining the transmission from mom to baby,
Mhm.
and just kind of what it takes to make sure that we are having healthy pregnancies and making sure our babies are don't have to be born with HIV. But this is this is when you have to have a physician that's kind of on top of it, and then your moms, just giving you the power to understand what it takes for you to be safe. And so I think this is really stressing the importance of why we have to have studies for pediatrics. And I know they may feel like that's unethical to try all these things on children, but it's still going to be very critical for the HIV cure research. And so, I'm, you know, I'm just really here for any type of talk about the importance of care during your pregnancy. So,
Absolutely, absolutely. Definitely. Well, I know you have a passion for that aspect, a real passion for that aspect of HIV treatment, care, prevention, and management, all of that. And it's huge, it's monumental because, the fact remains that if we can keep that population, the new babies, from being born with this, life limiting disease, if we can keep them from ever acquiring that, then we can improve our communities monumentally. I mean, it's the same as if we can prevent someone from ever contracting, ever developing, diabetes or hypertension. Uh, how does
right,
that affect their entire life to never have to be on insulin, to never have to be on blood pressure medications? The monies that's saved, all of the impacts that has. So yeah, definitely, to if we get, if we can get these mothers into treatment, into care, to where we're not passing that on to those babies, we're not just saving their lives, we're we're saving the money, we're saving the
that's
community,
right,
we're saving our community money as
that's
well.
right,
So it's a win-win for everybody. So yeah, definitely
right.
this type of research, having to hear that babies are being suppressed and still suppressed at 2 years of
Yes.
age, that's
And
amazing.
possibly not having to take medication. And so that's amazing.
That's amazing. So yeah.
All right. And so the next one, just a little, a few more. A possible treatment option for very young children with HIV. So they are reflecting on future directions of HIV treatment and discuss a proof of concept study using broadly neutralizing antibodies. And so the antibodies are like things that attack the
Target.
pathogen, yeah, the target,
Yes.
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 And so that's what we are needing. So these powerful anti-HIV antibodies can stop a wide variety of HIV strands from infecting human cells in the laboratory. And so that means they've done it in the laboratory.
Mhm.
And they had 25 children with HIV between ages 2 and 5 years who had begun the therapy less than 7 days after birth and had undetectable viral loads, were given monthly infusions by two. They call them those antibodies. They call them
Mhm.
BNABS. So that's what they're talking about.
Yeah.
So they delivered the first combination with ART, and then later, if the children's HIV remained undetectable without the ART, um, hold on. So they delivered first in combination with ART, and
Mhm.
then later, if the children's HIV remained undetectable, they did it without the ART, and
Wow.
that's the therapy.
Yes.
Okay. So 11 of the children maintained viral suppression through 24 weeks of the treatment, and 14, which was 56%, had a viral rebound for before 24 weeks. So these were like infusions that they were given in
Mhm.
addition to the HIV medication that they were receiving. The infusions were safe and well tolerated. So that makes a difference if you can tolerate it. And then he explained that parents found the infusions to be acceptable. and with many preferring them that rather than the daily therapy, like the medications that you would
Yeah.
have to take today. So that is amazing that you don't have to put a small child. I have to give my son allergy medicine every day. Now he is used to it because he's been doing it for a while, but there's something that you don't want to have to do it. If I miss it one day, or the weekend, or we go out of town and leave it, it's not a big deal. But imagine if that's something that you have to do.
Yes.
And the fact that it's is injectable, that they tolerated those injections, that's good news too. And so he discussed why he thinks that the antibody infusions will be important tool for future HIV treatment, prevention, and cure research again. And then they kind of talked about the long acting injectable for PrEP. We've discussed it before. And it just again, just like the simplicity of you having to do an
Mhm.
infusion versus you having to take a pill, and it is long acting. It says that I wanted to highlight something that I wanted to say. It was providing additional data about long acting injectable PrEP. It says among cisgender men and transgender women who have sex with men, the control trial previously demonstrated that a long acting form of HIV drug injected once every 8 weeks was more effective than on daily oral Truvada at preventing HIV acquisition in the study population. And so if it's more convenient and it's more effective, hey, I
Yeah.
mean, what is the future looking like?
Yeah.
And so he wanted to just kind of observe that scaling up available forms of PrEP and other HIV prevention tools will be the key factors
Mhm.
in achieving the goals of the national HIV/AIDS strategy and the ending HIV epidemic in the U.S. And so that was just one. And they were just bringing together all the researchers, all the information that came forward. They talked about the lady that is in remission at this point. And so, how do you feel about that before I go to our last little
Oh, and
piece?
that is, I mean, phenomenal. The thought of having an injection that I can take and not have to take for 2 months, as
Hmm.
opposed to taking 60 pills,
Yeah.
that is, I mean, that's monumental. And I mean,
And then,
we've come a long way with the pills when it comes to HIV management anyway, because, um, I know when I first started nursing, people had a sack full of medications. They were taking
hmm
upwards to 20 medications each round, and it was all they could do. So to just be having to have the Truvada where they're taking it, once or twice a day now, but to think about an injection once every 2 months, that's huge. That's
yeah,
definitely life changing. That's life changing.
yeah,
It
it
gives you
is.
life.
It is.
It's renew. It's life renewing. So yeah.
Yes, absolutely. And so this one, we talked about this amongst ourselves, but the NIH launches a clinical trial of three mRNA HIV vaccines. So, we were talking about those vaccines with COVID-19. This is kind of lined up on the same thing. And so they were saying with the success of the highly effective COVID-19 vaccines, um, they are having an exciting opportunity to learn whether the mRNA technology can achieve similar results against HIV infection. And so, they talk about those proteins and spike and all of that. So this is what they're talking about the mRNA vaccine. It works by delivering a piece of genetic material that instructs the body to make a protein fragment of a target pathogen, such as a virus, in which the immune system recognizes and remembers so it can mount a substantial response if later exposed to that pathogen. I will say that, people are not getting injected with HIV, so like that's not going to be part of the trial. The interesting thing is that the study does include Birmingham, Alabama.
Yeah.
So that is something that I wanted to bring out. So each investigational vaccine candidate is designed to present the spike protein found on the surface of HIV that facilitates entry into human cells. And so none of the three vaccine candidates can cause HIV infection. So I just wanted to point that out. And so they have 108 adults ages 18 to 55. And like I said, the site is Birmingham, Alabama, Boston, Los Angeles, New York City, Philadelphia, Pittsburgh, Rochester, New York, and Seattle. And so participants in Group A will be evaluated 2 weeks after initial vaccination to ensure the safety criteria has been met. And so that's what we always want to make sure that it is safe. And then safety and immune responses will be examined via blood and lymph node fine needle aspiration and samples taken at specified time points throughout the trial, and clinical staff will closely monitor participants' safety throughout the study. And the trial is expected to be completed by July 2023. So something was about 2023.
Yeah.
So that's good. They will
That
be
is amazing. Yeah.
say I didn't hear what you said,
Oh, I said
or
that
if
is
it's a little delay on
amazing.
my side. Yeah.
That's
So, I mean, just
amazing.
imagine that if that is something we would have, of course, convince the community to trust in it and to trust in the research. But if that really worked and every person that felt like if they wanted prep or they felt like they needed this vaccine and it could definitely work, I mean, that is talking about ending the
Mhm.
epidemic right there. So
Yeah.
I think they're doing some amazing research. I'm looking forward to what the next years are going to bring. And so we just want to make sure that you guys are in the know of what's going on with the different articles. And so we hope we didn't bore you too much, but I just think that um, that you ought to know. And we're going to help you know, and we're going to dissect it together because we are new to this world, but we're not new to healthcare. And so the compassion is going to be there, and we care about your future as well as the generations to come. So we do want to leave with just an update about what we have coming up, which is going to be the She Like Me She Treat. That's going to be like a retreat for the ladies coming off of, I'm going to say coming off of COVID-19, because I know things are the way what's coming down the pipeline. We talking about right now. So I'm talking about right now, but this is going to be an opportunity for you to kind of step away from what's try to reflect on what those emotions that you may have felt over the last couple of years, and kind of dissect that and give you some tools to kind of address it head on and begin the healing if you have experienced some loss. And it doesn't have to be person, but just loss of self. And I'm just really excited. Just in case you guys are not familiar with what will take place, going to be 2 days. Friday is going to be an opportunity for us to do like a meet and greet, relax, look at the grounds. It's a beautiful lake on there, and just take some time to yourself. We do have a comedian lined up to entertain us, to give us some laughter, because laughter is really good for you. Um, and then we also have a time where we can meet and greet, talk, have music. We do have a DJ. We're going to have fun. We're going to have game night. And so we definitely want to make sure that you take part in that and kind of reflect on what you want to work on, because the next day is going to be where the work begins. We will start early in the morning with a prayer walk and do some nice things to kind of get your mind right. And then we have some two amazing speakers. One's going to talk about overcoming depression with God. The next one's going to talk about like that trauma that you may have been through, and kind of talk about what healing looks like. Maybe it's been some type of generational thing that's taken place, and she's going to give you the tools to recognize, hey, maybe I had some trauma that I didn't even realize that's really affecting how I live life. And then we're going to end it with praise and worship, only like we like to do and know to do what we were created to do, and end with a powerful message. You will be fed food,
Fed
actual
and fed.
food. And that's going to
Food
be
and fed.
4 meals, y'all, and lodging is included. And so if you want to come by yourself, be brave. I'm going to be staying in a room by myself. That's $200. I think that is so affordable for what you're getting. If you want to come with a friend, we recommend that too. That's what, 160. And then if you're staying with 3 to 4 people, that's going to be 140. And hey, if you can't make 2 days, we have made it available where you can come on Saturday and pay $60. You still get fed, you still get the workshops. And I forgot to mention that we're going to be premiering our She Looks Like Me documentary and have a panel to discuss actually what stigma looks like, what it is, how it affects us in the future. So I don't think I have anything else to say. Did you? Anything else you
You
want to
covered
add?
it all. You covered it all.
Okay. All right. Well, we will sign off, and we'll definitely be back with more topics and things to discuss. You just have a great night, and we'll see you the next time.
Bye.
Bye.